Hey everybody, it's Rose from Sleepopolis, and today I'm going to talk about night terrors. In this video, you'll find out what night terrors are, what causes them, and what you can do about them. We'll also discuss who is most likely to suffer from night terrors and why. And by the way, if you'd like to dig deeper into this topic, head on over to sleepopolis.com, search for night terrors, and my article will come right up. And while you're there, check out my other articles on sleep disorders, children's sleep, and sleep health. Before we go further, I just want to say that this video is meant to be informative, but it shouldn't take the place of advice and supervision from your healthcare provider. If you feel you may be suffering from a sleep disorder or any other medical condition, please see a trained professional. Now let's get to it. Night terrors, also called sleep terrors, cause intense fear similar to that caused by nightmares. Night terrors are considered a parasomnia, which is a type of sleep disorder characterized by unusual behavior, vocalization, and movement. Episodes normally last anywhere from a few seconds to a few minutes, but can go on for 30 minutes or even longer. So what are the symptoms of night terrors? Well, they can be pretty scary to witness. People having night terrors might scream, flail, sit up in bed, run around, or exhibit aggressive behavior. Other common symptoms include overwhelming fear, mumbling, and fast heartbeat. Some sufferers of night terrors even leave the home, break windows, or damage furniture. So who experiences night terrors? Well, about 6% of children and 2% of adults have had the disorder. I asked Julie Wright, marriage and family therapist and co-author of the book The Happy Sleeper, to describe the typical night terror sufferer.
According to research, the typical sufferer of night terrors are children from the ages of about 4 to 12. I think one of the youngest babies that's ever been seen is around 18 months. We definitely see young children, preschool age, with night terrors, and they tend to dissipate and go away completely by the time kids reach adolescence or the teen years. They're very rarely seen in adults.
Now, night terrors sound a lot like nightmares, but there are some distinct differences. People who have nightmares usually remember what they dreamt and the emotions they experienced while dreaming. A defining feature of night terrors is amnesia, the complete inability to remember the experience the next day. Even people who are awakened during an episode rarely remember it. Sufferers can experience the effects of night terrors after waking, though, including daytime sleepiness due to disrupted sleep. So why do people remember nightmares but not night terrors? Well, nightmares take place during REM sleep, which is when most dreaming occurs, and night terrors take place during the deepest stage of sleep called N3. Night terrors take place during that stage of sleep or in the transition between N3 and REM sleep. Night terrors don't involve dreaming, but only intense feelings of fear. Another difference between nightmares and night terrors is that nightmares often cause people to wake up. People don't usually wake up from night terrors. Often the only way a person with night terrors knows that they have them is that a partner or parent witnesses them. Now let's find out how night terrors are diagnosed. Night terrors are usually diagnosed by a doctor based on a description of events. If the diagnosis is unclear, a doctor might recommend a sleep study, also known as a polysomnography. Though a sleep study can be helpful in some cases, the majority of people who experience night terrors can be diagnosed by symptoms alone. So how are night terrors treated? Well, infrequent episodes don't usually require treatment, but treatment might be required if episodes continue or disrupt sleep. I asked Julie Wright to explain what the treatment options are for this disorder.
In our experience, the best thing to try first is to see if we can get your child to sleep longer, to have more overall sleep. Often just a small amount of sleep debt can make night terrors more likely. So if we can work with the child's bedtime and wake time and see if we can get them even 30 minutes more sleep a night, we often see the night terrors go down or even go away completely. And this is because the nervous system and the sleep centers function better with more sleep, and these are probably indicated in why night terrors happen in the first place.
Now, some studies show that co-sleeping with young children can help reduce night terrors. Sharing a room with a parent can reassure a child and make night terrors less likely. If your child experiences night terrors, Protect them from stairways, windows, and leaving the home so they don't injure themselves. Explain night terrors and how to respond to them to anyone who stays with your child during a nap or at night. And remember, most sleep specialists advise against waking someone from a night terror and suggest instead keeping the sleeper as safe as possible until the episode passes. We get a lot of questions about night terrors here at Sleepopolis. Here are a few of the most common. Do night terrors go away on their own? Well, typically yes. Most night terrors go away on their own without treatment by adolescents. Why do night terrors tend to occur earlier at night and nightmares occur more often toward morning? We get this question a lot. Night terrors occur during N3 sleep, which dominates the earlier part of the sleep cycle. Nightmares happen during REM sleep, which dominates the later part of the night. Why can't children or adults be consoled when they experience a night terror? Night terror sufferers can't be consoled because they aren't conscious or aware of what's happening around them. They may be sitting up, their eyes may be open, but they aren't receptive to suggestions. Are there any medications that help night terrors? Great question. Doctors usually reserve medications for extreme cases of night terrors that might result in injury. Medications might include benzodiazepines like Valium or low doses of tricyclic antidepressants. Make sure you consult your doctor before taking any medications for this disorder. So there you have it, everything you need to know about night terrors. And remember, if you'd like to learn more about this disorder, check out my article link below. If you found this video helpful, be sure to like and subscribe to our channel and follow us on social media. Until next time, see you later, Sleepopolites.